Group 2 presents Dr. Sister Calista Roy's Grand Nursing Theory, the Roy Adaptation Model.
Biography. Dr. Sister Calista Roy was born in Los Angeles, California, October 14, 1939. She's an influential American nursing theorist, professor emeritus, author, and member of the Sisters of St. Joseph of Carondelet. She earned her Bachelor of Science in Nursing from Mount St. Mary's College in 1963, Master's in Pediatric Nursing in 1966, and PhD in Sociology in 1977 from the University of California in Los Angeles. Dr. Roy developed the Roy Adaptation Model, one of the most widely applied nursing theories worldwide. While a graduate student in the 1960s, she first published it in Nursing Outlook in 1970. The model views individuals or groups as holistic adaptive systems who constantly interact with internal and external stimuli, and it defines nursing's role as promoting adaptation across four modes: physiologic physical, self-concept group identity, role function, and interdependence. This framework has shaped nursing education, research, and clinical practice globally. The goal of nursing, according to Dr. Roy, is to promote adaptation in each mode, thereby contributing to health, quality of life, and dying with dignity. Her major achievements include over 150 publications, including 11 books, 4 honorary doctorates, faculty leadership at Mount St. Mary's College and Boston College, where she served as professor and nurse theorist for more than 30 years until retiring in 2017. Founding the Roy Adaptation Association and recognition as living legend by the American Academy of Nursing in 2007 and the Massachusetts Registered Nurses Association.
The next 3 slides will cover the worldview that influenced Calista Roy when she created the Roy Adaptation Theory. Roy developed her theory in the 1960s, which was a time when healthcare was changing really fast. Nursing was starting to become more independent and more scientific instead of just task-based, and there was a huge push towards science, research, and education in healthcare overall. During this time, people also began paying more attention to mental health, emotions, and human behavior, not just the physical side of illness. Women were also gaining stronger roles in education and leadership, including in nursing, which helped shape new ways of thinking in the profession. And overall, illness started to be seen as something that affects the whole person, not just one body system. All of these cultural and scientific changes influenced Roy's worldview and helped shape her idea that people constantly adapt to what's happening around them. Roy didn't build her theory from just one idea. She pulled from several areas of study. First, 2 big philosophies influenced her. The general systems theory explains that people are part of a bigger system, and they react to what happens around them, which connects to how patients respond within their environment. The second is adaptation theory, which focuses on how humans adjust to changes in health, life, and the environment. These ideas helped Roy see patients as constantly adapting. She was also influenced by different disciplines. Psychology helped her understand how thoughts, emotions, and coping affect health. Biology and physiology showed how the body physically responds to stress or illness. Sociology added the understanding that people don't live alone. They're part of families, communities, and social groups. And finally, nursing practice itself played a role because Roy used her real experiences as a nurse and educator to shape her ideas. All of these pieces came together to form the foundation of her theory. In summary, it all started with Roy's basic belief that people are adaptive systems, meaning we're always responding to what's happening around us. From there, she looked at how both the body and mind react to change, which influenced her thinking about health and illness. These ideas came together in her nursing theory, which focuses on helping people adapt in healthy ways. And that leads directly into patient care, where nurses create care plans that support physical, emotional, and social balance. Roy combined her worldview, science, and an understanding of human behavior to build a theory that supports patient adaptation in four main areas. These are physical needs, self-concept, role function, and interdependence. Overall, her concept shaped a nursing theory that helps nurses see the whole person and guide them toward better adaptation.
Hello, everyone. Today I'll be explaining the Roy's adaptation theory and then discussing how this theory connects to the four nursing meta paradigm: person, health, environment, and nursing. To start off, the Roy adaptation theory, also known as the Roy adaptation model, is a nursing theory that was developed by Sister Callista Roy. The main idea behind this theory is that people are constantly interacting with the environment around them. As they experience different internal and external changes, they must be able to adjust or adapt in order to maintain balance within. Sister Callista Roy describes each person as an adaptive system that uses both physical and mental responses to cope with challenges. The theory further highlights how when people adapt well, their functioning and health improves. However, when they cannot adapt effectively, their health can decline. Their nursing role is to support and strengthen the patient's ability to adapt in all areas of life. I will now be moving into the meta-paradigm connections and explaining how Sister Callista Roy defined each concept. I will now be discussing the meta-paradigm connections. The first concept I will be discussing in the meta-paradigm connection is the person. The Roy model views the person as a biophysical being who is continuously responding to internal and external forces. The model also views a person as continuously changing in response to their environment and constantly responding to what's happening around them. Their behavior and coping strategies shows how effective they are adapting. The next concept I will be discussing in the meta-paradigm connection is health. Sister Callista Roy defines health as a reflection of how integrated and balanced a person is. The Roy adaptation theory views health as more of an absence of illness and more of how well someone can adapt effectively. If their response helps to meet their needs, they are considered healthy. However, if their response failed to meet their needs, their health is considered to be affected. The third concept I will be discussing in the meta-paradigm connection is the environment. The adaptation theory explains how the environment has conditions and influences that affect a person's ability to adapt. It further explains how the environment consists of stimuli such as immediate stressors, supportive factors, and background influences. These environmental stimuli requires the person to respond, and they also play a big role in shaping a person's behavioral and health. The theory further explains how the environment is influenced into three types of stimuli: focal, contextual, and residual. The final concept of the meta-paradigm connection I will be discussing is nursing. The Roy adaptation theory emphasizes the purpose of nursing is to promote effective adapting methods. Nurses fulfill this theory by assessing what stimuli are influencing the patient, identifying whether the patient's response are effective or ineffective, and by planning interventions to best support healthy coping. Nursing can also take action to target their environment, strengthen coping mechanisms, or focus directly on physical, social, or emotional needs of a person. To conclude, the Roy adaptation theory provides a structured way to understand how people respond to change and how nurses can support and promote healthier adaptation methods. All four of these meta-paradigm concepts are closely connected in the Roy adaptation theory. Key points to take away are that the environment continually impacts the person responds through adaptive processes, and qualities of those responses determine their health. Nursing fits into this model theory by helping the patient improve their adaptive responses and manage environmental needs more effectively. I will now be explaining the additional key concepts and sub-theories that support the Roy adaptation model theory. To begin, one of the major concepts in the Roy adaptation model theory is the idea of stimuli. The theory explains that every person is constantly exposed to different types of stimuli in their environment, and this is divided into three groups: focal stimuli, contextual stimuli, and residual stimuli. Focal stimuli can be viewed as the main or most immediate issue a person is facing, while contextual stimuli can be viewed as the surrounding factors that make the focal stimuli better or worse. Residual stimuli can be viewed as background influence that may or may not be clearly understood, however, it can still affect a person's response. These three types of stimuli form the basis of how a person begins the adaptation process. The next key concepts I would like to discuss is the two main coping mechanisms, the regulator and the cognator. The regulator coping mechanisms involve more of an automatic physiological response. These can be seen in changes in hormones, vital signs, or reflective reactions. The cognitive coping mechanism involves more of a mental or emotional process, such as perception, judgment, emotions, learning, and feelings. Together, these two coping mechanisms explain how a person processes stimuli and create either an adaptive or maladaptive response. The next concept I would like to discuss are the 4 adaptive modes, which are highlighted in the Roy adaptive model theory. These modes can be described as the different areas of life where adaptation occurs. The first mode I would like to discuss is the physiological mode, followed by the self-concept mode, then the role function mode, and lastly, the interdependence mode. The physiological mode can be described as a basic physical need and body process. The self-concept mode involves a sense of personal identity and self-esteem. The role function mode can be viewed as how well a person performs their role and responsibility in life. And lastly, the interdependence mode can be viewed and focused on relationships, support systems, and exchange of love, values, and resources, amongst others. The importance of these modes are that it can give nurses a structured way to assess the patient's behavior and identify where adaptation is effective and ineffective. I will now be discussing the sub-theory of the Roy adaptation theory. This includes the theory of adaptation levels. This sub-theory can be explained as people functioning at different levels of adaptation. The 3 sub-theories of adaptation are integrated, compensatory, and compromise. Integrated can be explained as a response that is effective by a system that works smoothly. Compensatory can be explained as the body or mind trying to restore balance. Compromise is where adaptation is inadequate and a person's health becomes unstable. The Roy adaptation model theory helps us to understand the level of adaptation by nurses being able to determine the seriousness of a patient response and choosing the appropriate intervention for the patient. The last sub-theory I'll be discussing is the stabilizer and innovator subsystem. The stabilizer subsystems focus on maintaining a level of consistency and order. This is seen through policies, roles, and cultural norms. The innovator subsystems involve more of problem solving, creativity, and ability to adjust or improve systems when needed. These sub-theories allows the Roy adaptive model theory to be used not only individually but in group settings with families and organizations and communities. To conclude, these additional concepts and sub-theories truly help nurses to understand how stimuli are processed, how coping occurs, and how adaptive behaviors can be assessed and improved in different areas of life. By applying these concepts, nurses can better understand the patient's situation and create interventions that can truly support the patient and truly promote healthy adaptation.
The image on this slide is a simple schematic design representative of the Roy adaptation model. The process begins in the center, the core circle, which encases the person concept, and continues to expand outward through the environment concept, composed of the three types of stimuli: focal, contextual, and residual. This next image thoroughly portrays the complexity of Roy's adaptation model. The diagram reveals the overlapping influence of each adaptive mode in determining a coping process that is expressed as a behavioral response to the external stimuli introduced to the adaptive system, the person. Theory usefulness. The contributions of Roy's adaptation model are significant throughout the nursing profession. Let's review how. Practically, the theory has served as the basis on which the 6-step nursing process was developed and established. You know, the one that is mandatory to learn in school, that is implemented clinically as well. Assessment of behavior, which requires observation. Assessment of stimuli, which involves identifying and categorizing causes of the environment, including focal, contextual, and residual input. Nursing diagnosis, the formation of nursing diagnoses based on ineffective behavior in relation to stimuli. Goal setting, which is the selection of a reasonably attainable objective to achieve positive adaptive responses. Intervention, the creation and implementation of strategies focusing on managing the stimuli in order to promote adaptation. And evaluation, a measure of whether the indicated behaviors have moved toward the goal. Is the patient adapting? RAM is the foundation on which the nursing process was built. Additionally, the theory has altered the focus of nursing to be all-inclusive by considering the entirety of a person's well-being. This aspect is consistent throughout various levels of care and a variety of settings. Roy's adaptation theory has simultaneously impacted nursing education, serving as a framework for the development of many nursing curriculums. This revolution within the learning environment enhances the transition between the classroom to the clinical setting, encompassing the teaching of holism, and encourages the application of critical thinking. Roy's theory has been adopted by several institutions over the past 35 years, nationally and globally. Even in the realm of nursing administration, RAM is proven to be useful as an effective process by applying the concept of person to a group or organization, a body of people functioning as a unit for the adaptive system. This outlook aims to evolve with the ever-present challenges and always changing climate to adapt to the needs of the nursing staff, providing them with support to promote quality patient care and outcomes. And lastly, this theory is useful for application in research studies, both as RAM and as the grand theory from which middle-range theories are derived from. Middle-range theories offer practical applications to specific concepts from Roy's adaptation model that can be generalized for use in the different fields of nursing. With hundreds of research studies conducted, Roy's grand theory of adaptation has and continues to be a pertinent and prominent aspect in the science and art of nursing. Consider this, a patient case study. The patient's name is Mr. Smith. He is 85 years old, primarily diagnosed with dehydration, malnutrition, and altered mental status. Some background information. Mr. Smith is a retired veteran who lives home alone with no familial connections. He receives Meals on Wheels 3 times a week and attends weekly church service in town on Sundays. For this current admission, Mr. Smith was found down on the ground during a breakfast delivery by a Meals on Wheels volunteer. He arrived in the ED via ambulance for an unwitnessed fall. Imaging was negative for acute findings. Lab work and physical examination showed evidence of dehydration and malnutrition. Neurological assessment revealed a significant confusion. Mr. Smith was admitted to a med-surg unit where he received interventions to address his fluid and nutrition issues, which significantly improved, but his disorientation remains unchanged. Mr. Smith was diagnosed with moderate dementia and deemed incompetent to make his own healthcare decisions. Now a social admission, awaiting guardianship and long-term care placement, Mr. Smith has been a patient on the inpatient acute care unit for 5 weeks. Today, it is 3 p.m. and Mr. Smith has just woken up from an afternoon nap in bed. He shouts out, "Where am I? I'm going home." The bed alarm sounds, the call light flashes, and the nurse and nursing aide promptly rush into the room. When applying the adaptation model to the situation, the person or adaptive system is Mr. Smith. Taking a look at the environment and the stimuli, the focal stimuli, is the patient's desire to leave the hospital and inability to do so. Contextually, he has cognitive impairment from his dementia. His mobility has been impaired since the fall. Have the sensory element of the noise of the alarm sounding and an unfamiliar environment. Residual factors may include a lack of awareness of neurological and functional decline and lifelong independence and self-sufficiency. Next, we're going to take a look at health, the adaptation, via the application of the 4 adaptive modes, as well as potential nursing interventions to implement for an individualized care plan for Mr. Smith. The following table is an application of RAM on the patient case study previously described via the 4 adaptive modes, beginning with physiologic, some behavioral responses from the patient. He physically got out of the bed. He was disoriented and potentially incontinent. Some nursing interventions may include implementing frequent purposeful rounding to assess safety measures such as the bed alarm being on, and the utilization of things like PEEP, pain, elimination, environment, position. Is the patient in pain? Do they have to go to the bathroom? Is their environment clutter-free and safe? And are they needing repositioning to ensure that needs are met and to reorient appropriately? The next mode is the self-concept. Some behavioral responses within this mode. The patient is agitated and anxious. Some nursing interventions may include offering reassurance, actively listening, and redirecting focus. The next adaptive mode is role function. Some patient behavioral responses include frustration with the inability to do what he wants and to do it on his own. Nursing interventions may include empathetically acknowledging his limitations, as well as providing an activity that he can participate in, such as folding linens, doing a crossword, and so on. And the final adaptive mode refers to interdependence. The patient refuses assistance with care. Some potential nursing interventions here could be to reapproach the patient regularly to perform necessary care tasks, allowing some sense of control, and aiding in establishing a therapeutic rapport.
Testability through a case study. This case study forces us to use every part of Roy's model and show whether the patient is adapting effectively or ineffectively in each of the 4 modes. The patient, Mrs. Johnson, 68 years old, widowed, lived alone and was completely independent before surgery. Now, severe pain, can barely walk, needs a walker, constipated from pain medication, afraid of falling, feels useless and depressed. Children are worried and visiting a lot. Roy's adaptation model full application. The adaptive mode, physiological, physical mode. What the mode is about. Oxygenation, nutrition, elimination, activity, rest, protection, senses, fluids, neurologic, and endocrine. The patient's current behavior, as evidenced from the case. Severe pain at 8 out of 10. Constipation, no bowel movements times 4 days. Very limited mobility, needs a walker and assistance. Poor sleep because of pain. Is this adaptive or ineffective? It's ineffective. Why? Because the basic physiologic needs are not met, therefore threaten survival and healing. Adaptive mode, self-concept mode. What this mode is about: physical self, body image, personal self, self-worth ideals. Evidence from the case: the patient says, "I feel useless. I've become a burden." Crying, depressed mood, hates how she looks with the walker. Is this adaptive or ineffective? This is ineffective. And why? Because negative view of body and self-worth, therefore, physiological integrity threatened. Adaptive mode, role function mode. What the mode is about: social roles the person occupies, like mother, grandmother, independent woman, homemaker. Evidence from the case: the patient cannot cook, clean, shop, or do any household tasks. She cannot perform her previous role as the strong one in the family. This is ineffective because she's unable to fulfill primary independent adult and secondary homemaker roles. Adaptive mode, interdependence mode. What the mode is about: loving, relationships, giving, receiving support, balance of dependence and independence. Patient's current behavior: suddenly totally dependent on children and nurses. Feels guilty, asking for help, but also isolates herself at times. Just leave me alone. Is this adaptive or ineffective? It's ineffective currently. Why? Because dependence is appropriate right now, but she feels shame instead of accepting help. Therefore, imbalance. In summary, this case perfectly tests Roy's theory because it creates clear focal, contextual, and residual stimuli. It produces obvious, ineffective responses in all four adaptive modes at the same time. Most real patients have problems in 2 to 3 modes. This one hits all 4. It allows us to write a nursing diagnosis using Roy's language. For example, ineffective physiological adaptation related to pain and immobility, disturbed self-concept related to loss of independence, impaired role performance related to activity restrictions, and ineffective interdependence related to feelings of guilt over needing assistance. After nursing interventions, pain management, mobility, training, emotional support involving family, we can reassess and show how the behaviors move from ineffective to adaptive. That proves the theory works. Parsimony of the Roy adaptation model demonstrated through one of its derived middle-range theories. The Roy adaptation model is a grand theory and, as previously noted, is often described as moderately parsimonious because of its broad scope and numerous sub-concepts. However, one of the strongest arguments for the underlying parsimony, conceptual economy, of the Roy adaptation model is that a very large number of focused, highly parsimonious middle-range theories have been successfully and directly derived from it with only a few of Roy's original concepts. A clear example is middle-range theory, Roy's adaptation model of nursing applied to coping and adaptation processing in adults with chronic illness, specifically the theory of coping and adaptation processing, developed by Whitmore and Roy in 2002. And later refined by Roy herself in 2011 as the middle-range theory of coping adaptation processing. How this middle-range theory demonstrates the Roy adaptation model parsimony. Original grand theory, Roy adaptation model, has 6 major concepts: person as adaptive system, stimuli, regulator-cognator subsystems, 4 adaptive modes, health, nursing goal. This middle-range theory reduces the Roy adaptation model to just 4 core concepts. Number 1, focal and contextual stimuli, stressors. Number 2, cognator subsystems. Number 3, adaptive modes affected primarily self-concept and interdependence mode. Number 4, adaptation level outcomes, effective versus ineffective coping and adaptation. Everything else from the grand model is deliberately excluded, yet the resulting middle-range theory is complete, testable, clinically useful and has generated dozens of empirical studies with only these 4 concepts. This ability to strip down the grand theory to a very small, elegant set of concepts without losing explanatory power is strong evidence that the original Roy adaptation model, despite its apparent complexity, is actually conceptually economical and not redundant. It possesses high underlying parsimony. In conclusion, when evaluated through the lens of its derived middle range theories, such as the coping, adaptation, processing, the Roy adaptation model demonstrates excellent parsimony. Its grand theory structure contains just enough concepts to be comprehensive, yet is disciplined enough that highly focused, simple, and clinically applicable middle range theories can be generated from it with minimal elements.
Added value in advancing nursing science. A middle range theory based on the grand theory of the Roy adaptation model. Adaptive spirituality. Adaptive spirituality refers to the integration of one's beliefs and values, religious practices, and cultural values in adapting to physical illness, loss, and life's transitions. The main concepts congruent with this theory include person, environment, adaptation via the self-concept mode, assessing for psychic integrity via the moral, ethical, spiritual route with a focus specific to spirituality, and the cognator or cognitive emotive coping subsystem. The middle range theory described here utilizes the RAM framework with a specific focus on the positive effects of spirituality within the adaptive mode of self-concept during various challenges to substantiate its significance for promotion of its application across various clinical settings. To conclude this presentation, here is a quote from Dr. Sister Callista Roy herself. "The criteria for good is to promote adaptation of individuals and groups, to transform a society to one that promotes dignity, and to sustain and transform the universe."